Hello and welcome to McLaren Port Huron's Today's Health. I'm your host, Barb Winters. On our program today, we're going to be talking with board-certified infectious disease specialist, Dr. John Brooks, and we're talking about the flu. Dr. Brooks, welcome back to Today's Health.
Thanks, Barb. Always great to be back.
Let's start at the beginning. What is influenza or the flu?
So influenza is an actual viral infection. So a lot of times when people think about the flu, they really think about a gastrointestinal or a GI problem. Well, that's not what influenza is. Influenza is a respiratory infection. It's an infection of the upper respiratory tract in the lungs. So it's a viral infection. It is highly infectious from person to person, and it comes in episodes every year. It's epidemic on a yearly basis.
And what are the symptoms?
So influenza is actually a modestly severe illness in many people, especially older adults, where they will have a fever, they'll have chills, they will get cough. They usually get a stuffy nose, a scratchy throat, and the cough is associated with some shortness of breath in many people.
So every year we talk about the different strains. What's the strain this year?
So there have been many recent strains. If we go back to 2009, people remember it as the swine flu year. That was the last time we had what was called a pandemic. This year we have the H1N1. It's the one that rotates through and has been the last several years, but it has of course changed a bit.
Okay, so why is the flu so bad this year?
And what happens is that the influenza viruses, they have the ability to change themselves year to year. So we sit and think about, there's about 6 billion of us on the planet, right? So when you think about that number of people, you think about viruses, and when you think about influenza, it can affect, about a third of the population of the planet every year. So about 2 billion people or so actually get the influenza each year. So the ability of the virus to use us as a host and change and be able to adapt and become something different year after year is why influenza changes from season to season. It has this vast number of people that it infects, an environment that it's in, and an ability to change its genetics around a bit and waits to find the weakest ones, that's us, at the end of each year to then change its genetics up and become a new virus every year.
Wow, that's a little bit daunting. How do you diagnose the flu?
So influenza well, it can be diagnosed a couple of ways. One is just clinical. So for younger adults, if they know that they have a fever and chills and a cough and it's influenza season, it's probably what they have. It's very different than a cold because a cold doesn't cause a fever. And if it does, it's a low-grade fever. You tend not to get body aches from a cold and usually get a stuffy nose and a mild respiratory, little cough, little scratchy throat, and that's about it. You're not really sick with a cold. With influenza, you're ill. So you have the fevers and the body aches. You feel miserable. You want to be in bed when you have influenza. With a cold, you tend not to want to be.
Should you see your doctor as soon as you're starting to have some of these symptoms?
So that's really a great question. So the answer is if you have a cold, of course not. Because our goal is if you have a cold, don't see your doctor, number one, because we don't want you to get antibiotics. We want to preserve antibiotics for people who are sick. But if you do think you have influenza, which is going to be the symptoms of the fever and more significant symptoms, then yes, if you seek medical care quickly, then there's things we can do for you.
So how do you take care of yourself at home if you have the flu?
So if you have influenza, one of the most important things is keeping hydrated, because as an adult, when we get a fever, we get dehydrated, which makes us more ill. You can use antipyretics, which are going to be Tylenol and some Motrin to keep your fever down. Will also help your body aches. There's over-the-counter cough and cold preparations, which will help your symptoms, and it will help you feel a bit better.
And stay home as soon as you get those symptoms, right?
We certainly ask people to not try to go to work and try not to go out in public when they have active influenza because it's highly contagious.
What are some of the complications of influenza?
So influenza can be a very serious illness. So we have to basically look at it based on the age of the person and what's wrong with them. So young, healthy adults, when they get influenza, routinely they don't get very ill. They will recover from it and do relatively well. Now there are some strains of influenza that don't seem to mind young or old and gives us lots of troubles, and that goes back to the swine flu. If we go back to 2009, if we remember, a lot of young people got quite sick, including children. So when we look at influenza and we look at how serious it can be, the age of the person is quite important. Usually we look at older adults that have lung disease, people who have been smokers. They get a much more serious illness when they get influenza.
So is it like the things you should be looking for, like am I getting a complication, is a worse cough, a higher fever?
So basically it's the increasing shortness of breath.
Okay.
That'll be probably the biggest symptom that bothers people, because influenza, it's a respiratory virus, so it does infect the lung. Now most people, they don't get a viral pneumonia, but they can. And then what's even worse than the viral pneumonia is you get a bacterial pneumonia that follows. If we go back to the good old 1918 Spanish flu, that was back to the pandemic of the last century. Now that resulted in the deaths of 50 million people around the globe, which when you think about the population, then that was a lot of our population of our whole planet that ended up succumbing to influenza. But it was the pneumonia with the bacteria after the influenza that actually took their lives.
So why are children and young adults getting so sick and dying this year?
So children, because their immune systems are not well developed and their lungs aren't well developed yet, when they do get influenza, they can't fight it off as well and they tend to get sicker. They don't have as strong of an immune system, and unlike you and I, that have been around a while, we've seen influenza before. We've had vaccines or we've actually been infected, so our immune system is much stronger. It can recognize the virus and fight it off. Even if it's not the exact one that's floating through, the viruses still have some similarity and your immune system is primed, it's ready to go. So when you do see an influenza virus that you've seen something like before, you're more ready to fight it off. Kids don't have that luxury, they're too young. They haven't had the opportunities.
And the young adults that we heard about in the news over this whole period of time, do they just get overwhelmed by the disease, or?
So again, it kind of depends on the virus of the year, and some of the viruses tend not to care if you're a young or an old person, and it can cause the viral pneumonia and then result in other pneumonia. So otherwise young, healthy people generally don't get pneumonia, but they do. I mean, anybody can get pneumonia. Mm-hmm. So it's just one of those like luck of the lottery, right? Some people will get it. Why? Because they do.
Great information. We're going to take a break. We'll be right back.
Sounds good.